My name is Omid Termechi. I'm a dentist, and my focus and I'm in New York. My focus in dentistry is mostly revolved around dental implantology, restoration, as well as the surgical aspect of the dental implants. I've been practicing in New York, graduating from NYU in 1998. I have done a 1 year of a residency at Interfaith Medical Center in Brooklyn. Subsequently, the following year, I went to another residency again in Brooklyn, Kingsbrook Jewish Medical Center. And then after these 2 years, I did 2 years of fellowship, full-time fellowship in dental implantology at Brookdale Medical Center, also in Brooklyn, since I love Brooklyn so much. Yeah. So I've been placing implants since 2000, which is the beginning of my implant residency. In my residency, we used to do a lot of that because we were able to actually, in Brooklyn, the implant program was subsidized, so therefore the cost of implants were extremely low, so the patients were able to go ahead and afford it. So, and then after that, I've been placing, 10,000, maybe 15,000 by now. And I usually tell all my students, if life was just like implant dentistry, it would have been really easy. So it's been a really great passion of mine, and I've been very much blessed in doing what I do because I really love just going to work. Is fun and it's not work. And I enjoy it tremendously. If it wasn't for implant today, I would say, Carolyn, that I would probably be extremely bored of dentistry. So our practice is basically divided to two sections. One section is patients I walk into my practice through friends and family of old patients. And then there are referrals that come from different practices to us, whether they're complicated cases, whether there are problems with the patients, or unfortunately sometimes patients get implants at different other locations and it just did not work out so well, so they turn to us for some resolution for those particular cases, whether it's an aesthetic issue, whether it's a functional issue. We try to go ahead and attack those challenging cases as well. But every day patients walk into the practice, and a lot of patients in the statistic of how many patients walking around the United States that are missing a tooth or more in their mouth that they require dental implants. But our focus. Here you go. That's it. Exactly. It's a big number, and you know what? I tell everybody that, especially my patients when they come in, one of the big questions is this the right treatment for me to go ahead and partake? And my answer always is a steady, same answer to every single patient. I say to them, there are two reasons why you should not have dental implants. One, if you are really medically challenged and you really have serious medical issues that you cannot get from your medical doctor, they would say it would be really a no-no for the patient to go ahead and go through the procedure. And two is finances. Those are the two real major things. Age today is not an issue. We provide dental implant. My oldest patient that I've placed an implant on was 97 years old. It is a patient that did not 97 And I have to tell you, she looks really, really fantastic. Lives by herself, takes care of herself. She is really, really great. I have a photo with her. It probably is my website right now, but she, and she said, I don't want to walk around with teeth that come in and out of my mouth. So, age is not an issue. Yeah. So I started teaching in NYU since 2006. The department that I'm involved with is the Department of Implant and Periodontics. It's a postgraduate periodontics, and we have 2 years of full-time fellowship in dental implantology for international students who come from other countries to spend 2 years with us in New York and to learn all aspects of dental implants, restoration as well as surgery. And I've been doing this, 12 years. And time flies very quickly. And to just answer your question about, just like you mentioned, there are a lot of people walking around without implants, without teeth, rather, I apologize. And, because of that, the demand and today more patients are educated about implants. They actually walk into the practices and they ask the dentist about getting dental implants. And, because of that, I came up with an idea of creating a course that would be able to go ahead and train a general practitioners to be able to place dental implant in their own practices. 1, 2, 3 implants, predictably using the state-of-the-art digital dentistry to guarantee the proper implant placements. And this is a course that I came up with, and the name of this course is Dental Implant Surgical Seminar. It's a 4-day course that general practitioners can go ahead and take. It's given out of the country. They get an opportunity to partake in my lectures, to learn, and to be able to go ahead and follow the protocol that I have set for them to have a successful implant office themselves, and for them to come in and actually be able to practice on live patients and be able to place implants, up to 20 implants for the seminar in 4 days. Right. So I'm going to say that everybody says, dentists go, they take a weekend course and they, advertise for that particular discipline, and they try to go ahead and do the work. I'm not training, they're not going to become a specialist in 4 days. This is a beginner for people to get themselves involved and get going. If you take a course on endodontics over the weekend, you do not become an endodontist. If you take an orthodontics course, you do not become an orthodontist in 4 days, over a weekend. What I try to do here is to say to somebody, if you are interested to learn about surgery, let me show you how you could get started. I will tell you what are the appropriate cases, appropriate patients, appropriate situations where you, as a beginner, can handle. Here are the tools. Here's the protocol. Follow what I give you, and you will be able to successfully execute those particular cases just as good as a specialist. Now, of course, I don't tell the general practitioner, stop working with your periodontist, stop working with your oral surgeon. That is not my message. I'm not trying to tell them don't work with those guys. You have to keep those guys. But there are cases that are going to come in front of you that even you will be able to handle if you follow these protocols. And, to my specialist friends, I would say that when you train a general practitioners to recognize what they can and cannot do, they would have a better eye looking for those complicated cases to refer out. So this is not only going to generate more patients and income for a general practitioner who will take my course, but also will be able to go ahead and generate more patients and more income for their referring doctors, oral surgeons, and periodontists. So I'm going to say that the format of the course is as follows. They arrive in Guatemala on a Sunday night, whatever the case may be. That's the day before the course. Monday morning is the first day of the course. We get picked up in a hotel. We go to the university. This course is given in a state-of-the-art University of Francisco Marroquin in Guatemala. I'm just going to, for a second, just mention that, I teach in NYU, as we said before, for 12 years. They are more on the cutting edge of the technology and state of the art than we are in NYU. It's strangely enough, people don't believe it until they actually come there and see it. I'm really excited about that because when all my participants come there, they're really surprised at the facility and the condition of where we're working. But going back to the schedule, first day is a full day of lecture by me. I lay down the protocol of, from the beginning, where the patient comes into your practice for consultation, all the way to the very end, working the patient up, setting the patient up for the surgery, doing the day of the surgery, following up the patient during the healing period, and also long-term follow-up after the restoration is done. That would be day one. Basically, you would know what are the cases that you want to attack. Day two, we introduce a computer-guided surgery into our program, which is a cutting edge of what implant dentistry is today. And we basically go over how to read a CAT scan, how to plan your cases, how to generate a guide for those particular patients that you have in your practices and be able to execute the cases just like a pro and a periodontist, a oral surgeon, and whatnot. We will also practice on day two on model jaws. And then after that, they will go into the clinic for a simple case that is all picked by me for those particular doctors. Very small procedures, very small cases, 1, 2, maybe 3 implants, nothing complicated. And then day 3 and 4 is all day surgery from the morning, 7 o'clock to 7, 8 o'clock at night, and we have a lunch and learn. One of the faculties will go ahead and give a lecture for them, whether it's a bone grafting, whether it's extraction. Carolyn, I do see a tremendous amount of confidence as we go through the course from day 2, which they do a simple case, to day 3, and then, of course, day 4. You do see that their confidence really gets built up, and they actually, at times, with just walking around, the faculties are walking around, and they see that they can go ahead and perform the surgery. Again, we're not training in 4 days oral surgeons who go for 3 years in, 4 years of residency, or periodontists 3-4 years. Of course, those guys are more proficient because they have just simply done it long enough. But I can certainly tell you, if they take this course to just jump into the pool, and once they get themselves going, then they have to still continue more education, whether didactic, whether some more hands-on, and simply doing it in your own practices to get more comfortable. And you will get there. It will take a little time, but you will get there as far as performing, up to specialist standard. So we have ran this particular program, Dental Implant Surgical Seminar, twice already, and one was in February of 2018 rather, I apologize, and one in August, in July. And so far, this is a university that patients basically walk in for dental treatment. Like any university, like Columbia University, NYU, all these, universities in the country, in the United States, they come in because they recognize that university fees are much lower and they can go ahead and afford basically doing it. But most of our patients so far have been friends, family, and even the employees of the university because, we offer to them free dental implant surgery. They don't have to pay for the implant because it's being subsidized by our sponsor implant company, which is Blue Sky Bio, with the university themselves, and with the ISS, our program. So the patients are able to go ahead and get the surgery for no cost to them. So far, we've been providing this service to the very close relative of the UFM, the university, because this is exciting for them and they really want to take advantage of it. But soon enough, there are patients who are knocking on the door and they want to come in and they want to get this as well. Correct. I basically thought to myself that if I'm able to go ahead and provide this service for free of charge to the resident of Guatemala, why can't I go ahead and give the same offer to the residents of the United States? So what I have suggested to the dentist participants who join my program, if you have a patient in your practice that is reluctant to get the dental implant based on the cost of the dental implant, just to let you know, there's two costs to dental implant. One is the surgical aspect of the dental implant procedure, which is to place an implant into the bone underneath the gum. And then the second portion is to actually fabricate the teeth and make the teeth for the patient. So the surgical portion, I can basically offer free of charge to any of the patients of my participants who want to join us in the program over there and be seen by their own dentist. So we had a couple of dentists who brought their own patients. These are old patients of theirs in their own practice. They've been seeing these dentists for many, many years. And now their dentist decided to take this course and they want to take advantage of getting a free surgery. So they basically joined the dentist coming to Guatemala, and we provide, one patient got a sinus lift and 15 implants, which you're looking at somewhere between $30,000 to $35,000 worth of surgery for free of charge for the patient. And I'm only talking about surgery. I don't want people to misunderstand that there's no cost for the teeth portion of it. That's cost of the teeth. They discuss it with their dentist. But if the dentist wants to come to us, they can charge the patient for the restoration portion, bring the patient there, and the patient can get the surgery from them with the supervision of one of the DISS faculty. And we have had a couple of patients that were ecstatic about this, and they were very, very happy, and they got the entire treatment, their entire surgery, for free of charge. And to those patients who are maybe listening and maybe interested and they want to find out more about this, I can certainly tell you this is not a procedure that you go in and you stay for 2 weeks in Guatemala. It's not that way. You come in, let's say on a Tuesday, you stay over in a hotel Tuesday night, you get your surgery, you get the priority since you're out of state, you get your surgery Wednesday morning, and you could be on an airplane going back home Wednesday afternoon, Wednesday night, whatever it is. You don't have to stay there. You can just come in for a day, 24 hours, in and out. And, the dentist goes back to their own practices the following week on Monday, and they can do all the follow-ups for their patients in their own practices back home. Sure, yeah. So we actually, we have two separate courses. There is a more advanced course of sinus graft, which is to make it in a simple way, it's a bone grafting, a specific bone grafting to lay the foundation for the implant, which is kind of falls into the more advanced people who have been doing dental implant. Now they want to get, do the sinus graft, which is a little bit more advanced kind of procedure. So we have a course on that, and it's in December of 2018, and we take 8 participants for that course. And then for our implant course is 16 participants that we can go ahead and take, and that is going to be on in February of 2019. And all that information is simply on our website, Dental Implant Surgical Seminar.com, and they can go ahead and check it out and see, and the best thing is really, Carolyn, I would suggest for, dentists out there who are interested in this to pre-register so we can get some information, and, somebody from our office will give them a call. They will get more information coming directly, automatically into the email to them. And pre-registration does not mean that they are locked into taking this course. It just simply means I want more information to know about this course. But we can certainly talk to them individually and, answer any questions they have. So we have had actually people from Canada and all around the country, Louisiana, Alaska, Chicago, Tennessee, Texas. This is not a New York thing. This is basically open for business for anybody from anywhere in the country that is interested to go ahead and get. By the way, we do, just to mention, we also do provide a 40 CE credits for people for their licensure, and we also provide a certificate that is a joint certificate from the University of Francis American as well as the ISS. But anybody we have had actually a diverse doctors coming from all around the country, actually. It's an AGD. It's a PACE AGD, and it's usually provided right away after they take the course. When they get back home, we submit that information, and they will get their certificate of completion of 40 credits mailed to them, and then they can go ahead and use it for other tertiary implant organizations out there, they will be able to go ahead and also submit for that. I don't want to mention any names, but they will be able to, get fellowship, associate fellowship of, other implant organization that of their choosing. Oh my gosh, it is such an amazing thing because every night, right away we cover all accommodations. The only thing that the dentists have to do is to get themselves there. But every night we go out to dinner and we basically go over what happened that day. And we're sitting around the table at the restaurant and we are, enjoying our meal and drinks and people kind of connect with each other and they talk about their day and if there's anything that's very, very important that somebody asks me, I kind of bring it to the attention of everybody. But this is really 4 days of pure dental geeks getting together and only talking about implant dentistry. I mean, at the end of it, I think they're just sick of it. They say, we need a vacation from it. But we have fun doing it. It's really fun being in the clinic. When the participants are there actually doing live surgery, we have a resident right next to them from UFM. We have an assistant right next to them, and there's a faculty there. So they kind of surrounded with everybody because the resident who's assisting the participant, that's the patient, is actually his patient. And he's going to do, or she is going to do the restoration, the tooth portion. So it's important for that resident to be there to know how the procedure went at the time of surgery. So, and the assistant, of course, is there to help if they need anything. And the faculty is there basically to just monitor and make sure everything goes well. But that's how we kind of work it out. So it's right. So it's interesting you asked that question. First of all, I'm still in touch with all my participants. I have created an account in the social media on Facebook, and that is closed to general public, and it's only created for the alumni, faculty, the students of UFM, and myself. And basically, this is a safe zone